Hello friends, I'm your mentor Dr. Asma this side. Friends, today I'm summarizing the topic of menopause and the mental health. This topic has been taken from the TOG article which is released in 2023 by the Royal College of Obstetricians and the Gynecologists. Friends, according to this TOG article, menopause is defined as cessation of the menstrual cycle. Menopause results from the loss of ovarian follicular activity. It is a retrospective diagnosis with a natural menopause being recognized after 12 months of amenorrhea. The median age at which menopause occurs in the UK is 51. Brain fog is an increasingly recorded symptom of the menopause. Many women describe their brain as feeling like cotton wool, having difficulty in concentrating and increasing forgetfulness. Mental health symptoms around the menopause may be of new onset or worsening of the pre-existing symptoms, and if not managed appropriately, can contribute to significant disease burden. Friends, according to this TOG article, mental health conditions which are associated with the menopause are depression, anxiety, sleep disorders, and Alzheimer's disease. Coming to the depression, there is a good evidence that association between menopause and the depression. Depressive episode is characterized by the period of depressed mood or diminished interest in the activities occurring most of the day, nearly every day for at least 2 weeks, accompanied by the symptoms such as difficulty in concentrating, feeling of worthlessness, excessive or inappropriate guilt, hopelessness, thoughts of death, and the suicide. Friends, according to this TOG article, there is different validated depression questionnaires that have been used in the research studies, and these have been mentioned in the box 1. Please have a look. There are many contributing factors associated in time with the onset of menopausal symptoms. Compared with the premature menopause, menopause at the age of 40 or above are associated with 50% decreased risk of depression in the later life. And coming to the anxiety, there is inconsistent evidence that the anxiety is associated with the menopause. The relationship between anxiety and the menopause is less well researched than that between the menopause and the depression. Sleep disturbance. There is a weak evidence that the sleep disorders are associated with the menopause. Vasomotor symptoms affect up to 80% of the women during menopause. It is hypothesized that they result from the disturbance of the thermoregulatory mechanism in the hypothalamus triggered by the decreased estrogen levels. Sleep disturbance may also arise in the menopause in association with the primary sleep disorders such as sleep disordered breathing, restless leg syndrome, periodic limb movement disorders. So the sleep disturbed breathing is characterized by snoring, upper airway obstruction, inspiratory flow limitations, and excessive daytime sleeplessness. This could be associated to the loss of protective effects of the female steroid hormones as well as fat distribution changes after the menopause. Then Alzheimer's disease and the cognitive aging. There is no evidence of an association between Alzheimer's and the menopause. However, female sex hormone is a major risk factor for development of the late onset of Alzheimer's disease. Brain imaging in women shows that the presence of an Alzheimer's disease endophenotypes with a decreased metabolic activity and increased beta amyloid deposition in the perimenopause and postmenopausal period. Now the management is discussed in this TOG article. According to this, the awareness among the healthcare professionals is a key for the early diagnosis and the effective management of the menopause-associated psychiatric illnesses. For the management of menopausal depression, the 3 main treatment aspects are hormone replacement therapies, antidepressants, cognitive behavioral therapy. Coming to the antidepressants, for the mild depression, the recommended treatment options include use of antidepressants, psychosocial therapies, and the lifestyle changes with the supportive strategies. This statement recommends that the antidepressant should be offered to women who present with a moderate to severe depression. These are effective regardless of the baseline severity. The choices should be made in accordance with the NICE guideline. These suggest an SSRI is the first line of choice. If the patient fails to respond within 2 weeks, a change of the class of antidepressant is usually successful. HRT or the hormone replacement therapy is discussed particularly in this TOG article. According to this, HRT is recommended for improving the menopausal depression, especially for the vasomotor symptoms, but only in the perimenopausal women, not in the postmenopausal women. Currently, HRT is not licensed for the treatment of menopausal depression in USA and the Europe as well. HRT improves the vasomotor symptoms and often sleep pattern, which in turn can help improve the women's quality of life. The NICE guideline recommend considering menopausal HRT to alleviate the low mood that arise from the menopause. Now, psychotherapies are mentioned. CBT, problem solving therapy, and interpersonal therapy are the most documented approaches of the psychotherapy. In severe depression, patients are too ill to engage in the process. CBT help depressed patients to replace the negative thoughts with the positive ones. And interpersonal therapy focus on the interpersonal conflicts and the social interaction. CBT is particularly beneficial for the menopausal related insomnia. Lifestyle changes. What lifestyle changes are beneficial? Healthy lifestyle changes, including reduction of alcohol intake, smoking cessation, exercise, sleep hygiene, are recommended by the Royal Australian and the New Zealand College of Psychiatrists as well. Greater intake of lactose, fruits, and vegetables and the fibers are negatively associated with onset of depression. Effects of phytoestrogens on depression, anxiety, and mood disorders remain unproven. There is some evidence to suggest that isoflavones may augment SSRI in depression. Friends, according to this TOG article, the depression around the menopause is an increasingly recognized condition, requiring timely diagnosis for effective management. While HRT has its beneficial effect on the menopausal depression, the role of antidepressants for the selected women cannot be underestimated. It is vital to establish the diagnosis of the clinical depression and distinguish it from the menopausal depression. So friends, to conclude this TOG article, women presenting with the menopausal symptoms of the hot flushes, night sweats, sleep disturbance, fatigue, low mood, or the new onset depression are expected to respond better to the HRT on its own or in combination with antidepressants. CBT, with or without antidepressants, would seem to be better choice for the women presenting with symptoms of anxiety and stress related to the life events around the menopause, and for those where the HRT is contraindicated. So this is all about this TOG article. Please have a look. Have a great day.